Hello, I'm Jonathan Herland. I'm an interventional pain management physician. We're here today to discuss sacroiliac joint pain. The sacroiliac joint is located back here at the base of the spine. It's a location on either side where the sacrum fits like a wedge into the pelvis. Approximately 85% of the body's weight is carried through the sacroiliac joints. So these are obviously very important. Pain can develop typically over time. It's one of those structures in the body that does tend to wear out as we get older, and sometimes it gets inflamed and can be the source of significant pain. Sometimes, however, it can also develop in a young woman shortly after childbirth. Either way, the problem can be quite tricky to diagnose and sometimes a little bit tricky to treat. From the diagnostic standpoint, sometimes the pain is felt only in the low back here, but sometimes it can be felt shooting down the leg, typically in the back of the leg, sometimes on the outside of the leg. Sometimes pain from the sacroiliac joint can also be felt in front, where it can be mistaken for pain that originates in the hip joint. On an examination, it can also be a little bit tricky to diagnose because some of the maneuvers on an examination that we use to stress the sacroiliac joint will also sometimes stress the hip joint, can also sometimes stress these nearby small facet joints. One of the hallmarks of sacroiliac joint pain is that if the pain is present when you are sitting, that you can relieve that pain by shifting the weight onto the opposite buttock. Treatment in my practice consists of two different techniques. The first is a combination of diagnostic and therapeutic, in which I would use X-ray to guide a needle into a joint like that, and then inject medication, including steroids, to try to calm down the inflammation over a period of a week or two, and also local anesthetic to numb up the joint. The reason for that is that if we can temporarily block your pain, we can then confirm our diagnosis. If we've done one or two injections and you've gotten excellent relief, we can repeat them from time to time and keep your pain under good control. Alternatively, if we've gotten only diagnostic responses, that is very temporary relief of pain, and your pain continues to return after injection of steroid, then we would move on to Plan B. Plan B is something called a radiofrequency denervation. It's a way of cauterizing the tiny little nerves that go to the joint and would be the subject of another discussion. Finally, as a last resort, if we cannot relieve your pain with either of these two techniques, then referral to a neurosurgeon for consideration of sacroiliac joint fusion would be the next step. Thank you.